This bone right here is the mandible. Head. The head of the mandible, this thing right here. We've got the neck of the mandible. Neck. Okay, the condylar process. I don't know where the heck it is. The condylar process, this right here, the condylar process. Coronoid process. Mandibular notch. The ramus. The angle. The body. Oblique line. Mental protuberance right in the middle, mental tubercles on the sides, the alveolar process. The alveolus is the hole where the tooth sits. Where the heck is the mylohyoid line? I think it's on the back. The mylohyoid line, and then over here, the mylohyoid line. The mandibular foramen, mental foramen, maxillary bones, frontal process, orbital plate, zygomatic process, infraorbital groove, infraorbital foramen, alveolar process, same as on the mandible. It's just the part of the tooth here that like comes out like that. And then the alveolus is the hole up in there where the tooth sits. The palatine process, the incisive foramen, anterior nasal spine, the zygomatic bones, the frontal process, maxillary process, the temporal process, the orbital process, the zygomaticofacial foramen. Palatine bones. Orbital process, you're kind of on your own for that one. So it's got to be like up under there somewhere, but I don't know exactly. So get professional help, which is not me. All right, so nasal crest. Is this right here. Nasal crest right here. Nasal spine. Posterior nasal spine. Okay, so next up are nasal bones. Nasal bones, these two right here. Nasal bones, nasal bones. I think it's better to see on this side. Lacrimal bone right here. Inferior nasal concha. Okay, so in ours, you can see on each side there's only 2 in there, and there should be 3. So this should be inferior nasal concha right here. All right, and then this right here is the vomer. Right here, vomer right here. And then we've got the ethmoid bones, and then the first one is orbital, the orbital surface of the ethmoid bone. Okay, so this side, okay, we've got optic canal right back there, and then it's the one that's touching it right here. So the orbital surface is right there. the cRibRifoRm plate, perpendicular plate up here, vomer down here, perpendicular plate up here. Right, so the superior and middle nasal concha. Okay, so ours only has 2 in here, but it should be inferior nasal concha, and then up in here it should be the middle nasal concha, and then there should be one that's further back. It's more posterior and superior, and right back there would be the superior concha. And if you turn it around, it's not even back. It's not even back here either. Like we can see from the back, this is the inferior, this is the middle, and there should be like another one up in here that would be the superior. There's kind of a little bit of something right there, so maybe that's what it is on this one, but there should be 3 in here. But in ours you just see 1, 2, and maybe a tiny bit of a third right there. All right, so frontal bone, and for some reason it does not fit on there properly, but we'll do our best. Okay, so frontal eminences on the sides right here, the sticky outy parts. Frontal eminences, superciliary arch, supraorbital foramen, glabella, nasion, maxillary process, zygomatic process, orbital surface, temporal bone, the squamous region, the petrous region, styloid process, the external acoustic meatus, the zygomatic process, mastoid process, mandibular fossa, articular tubercle, carotid canal, stylomastoid foramen, internal acoustic meatus, groove for sigmoid sinus, parietal bone, parietal eminence. It doesn't fit. Occipital bone. Foramen magnum, external occipital protuberance / inion, external occipital crest, nuchal lines, superior nuchal line, inferior nuchal line, occipital condyle, pharyngeal tubercle, basilar part, condylar canal, hypoglossal canal, internal occipital protuberance, internal occipital crest, groove for occipital sinus, groove for transverse sinus. Okay, sphenoid bone, greater wing, or inside greater wing. Infratemporal crest right down here, infratemporal. Medial plate of the pterygoid process, lateral plate of the pterygoid process, the hamulus, lesser wing, anterior clinoid process. The body is this whole thing right here, right in through here, the body. Right here is the jugum. Right underneath the jugum, the chiasmatic groove. And here is the sella turcica. This whole squared off part right here is the tuberculum sellae, hypophyseal fossa, dorsum sellae, posterior clinoid process, optic canal, superior orbital fissure, inferior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum, miscellaneous, which includes Jason the cat, zygomatic arch, temporomandibular joint, temporal lines, which are not shown on our skulls very well. Mine doesn't even fit together, but it's not the suture line, but it's right above that, and it's two lines that go across there. I'm just gonna put pictures online. Where all the sutures here meet, pterion, jugular foramen, orbits, fossa for lacrimal sac, sagittal suture, coronal suture, squamosal suture, lambdoid suture, lambda, bregma. Nasal septum is this whole thing, plus some cartilage that wouldn't be shown. Choanae are the nose holes. Hard palate. All of this hard palate